Hi ladies, and welcome to this week's 2-minute tips. This is a super quick one today. I often get asked what size fit ball should you purchase during pregnancy. So the things to look out for with fit balls is please make sure they are anti-burst. So this just means that if it got a puncture in it or a hole, instead of just bursting underneath you, which obviously we don't want tailbone injuries, it will just slowly let the air out. So make sure it's anti-burst. Now, when it comes to sizing, everyone's going to be different. It will depend on how full the ball is with air. You want to try and keep it pretty inflated. You don't want it too soft and saggy. But you want to make sure that your hips and knees are at about a 90-degree angle. So if the ball is too small and your knees are above your hips, you're going to get probably a bit sore in your hips and your lower back because you're sitting in that slouchy hip impingement position. So try to avoid balls that are too small where your knees are higher than your hips. On the other side, obviously, if the ball is too big, it's going to be uncomfortable. You're going to find that you're going to have to sit far too upright on it. You might get a sore lower back. So for me, I'm 172 centimeters and the 70 or 75 centimeter balls work best for me. So hopefully that gives you a little bit of a gauge as to what might work best for you. So remember, anti-burst, hips and knees at about the same height, and make sure that it's pretty well inflated. If you can, try and borrow a ball from a friend if you're trying to get a gauge for what size will fit you best. And if anything, you're probably better to err on the side of slightly bigger than too small. And remember, they're not just for sitting on, they're for all sorts of different uses during labor, birth, postpartum, during pregnancy. They're so multifaceted in their uses and what you can get out of them. So slightly bigger is going to be better than slightly smaller, and I hope that helps.